Healthcare now is being viewed more as an experience, and compared to airlines and shopping malls and Zappos, and I think the more we're on board with understanding the overall patient experience and improving that experience, the better all will be. Physicians will have a greater enjoyment of their practice by being assisted in these things that inevitably have to be done but are difficult to do on our own. So I think the experience of both the patient and the physician are very important going forward in creating a better total outcome for both.
With that backdrop, the Nebraska Health Network formed several physician-led clinical work groups, including the Gastrointestinal Work Group, to focus on evidence-based practice guidelines, opportunities to improve quality of care and patient experience, and reduce costs in the network.
This partnership makes so much sense and is inevitable, that our personal and professional relationships are key. This is a relationship that is built upon interactions that take place regularly, where the most cutting-edge care is made available through efficient and cost-effective means.
One of the things that I've felt over the last several years has been a problem with medicine is that the communication between physicians has actually declined in a time of what we think has been an explosion of communication. We see each other less. We used to see each other in the doctor's lounge and communicate and talk. I used to know who my referring doctors were, and that's really not the case anymore. And so I think a lot of going forward, it's going to be increasing communication.
But the GI work group didn't get together just for coffee and a chat. The group collaborated on clinical care recommendations for multiple conditions and launched a colorectal cancer screening initiative with wellness partner Simply Well.
So we've tried to pick the disease processes that we could do the most good early on in terms of improving quality outcomes and reducing overall cost of the system.
You can do a study at a major university system, for example, on the east or west coast, testing a couple hundred patients. But bringing that new cutting-edge therapy to the community requires several different considerations. And by working together, our group and the group of Midwest Gastroenterology, I think, are a very effective team. And again, I keep saying partnership over and over, to providing that care to the community.
With some clinical best practice sharing under its belt, the GI work group will keep working together to tackle the new world of increasing regulations, data integration, cost containment, quality metrics, and patient experience.
It's not the old days of where the one doc controls the show, and it now does take a village in order to treat a patient. Quality is not only in just the delivery of the healthcare product, but the overall experience of the patient, and that experience matters now, and that if we're not aware of that, we will not win the battle.